How does abscess drainage prevent diverticulitis complications? Imagine a small pocket of infection forming in your colon due to inflamed diverticula. When this pocket fills with pus, it becomes an abscess. If left untreated, this abscess can grow, rupture, or spread infection to other parts of the body. That's where abscess drainage comes into play. By guiding a thin tube into the abscess, doctors can remove the infected fluid directly. This process is often done using imaging techniques like ultrasound or CT scans to locate the abscess precisely. Removing this pus helps control the infection locally and allows antibiotics to work more effectively. It also prevents the abscess from enlarging or rupturing, which could lead to serious complications like peritonitis, an infection of the abdominal lining, or sepsis, a life-threatening systemic infection. Drainage is especially helpful for abscesses larger than 3 centimeters, which tend to respond poorly to antibiotics alone. When a large abscess is drained successfully, it often stabilizes the patient and reduces the need for emergency surgery. This means that instead of rushing into a colon removal procedure, doctors can plan a more controlled, elective surgery later on if necessary. This approach lowers surgical risks and improves overall outcomes. Another benefit of abscess drainage is that it lowers the chance of the abscess coming back. Patients who have their abscesses drained tend to have fewer recurrences than those treated only with antibiotics. During the drainage process, healthcare providers regularly flush and adjust the drainage tubes to keep them open and functioning well. This ongoing management ensures that pus continues to be removed effectively. The location and size of the abscess influence the treatment plan. For example, abscesses in the mesocolic area might be managed with drainage and antibiotics, while pelvic abscesses often requiring drainage followed by planned surgery because of their higher complication risk. It's important to remember that while drainage is very effective, it does carry some risks like blockage of the drainage tube or the need for repeat procedures. That's why close monitoring and follow-up care are essential. If drainage and antibiotics do not resolve the problem, surgery may become necessary. In summary, abscess drainage in diverticulitis works by physically removing infected material, controlling infection, and preventing the abscess from worsening or spreading. This helps avoid emergency situations and reduces the chance of severe complications. Current medical guidelines recommend image-guided drainage for abscesses larger than 3 centimeters in stable patients, often combined with antibiotics and sometimes followed by planned surgery. Every patient is different, so personalized medical advice from healthcare professionals is always the best course of action.